Today, my topic of presentation is myocardial infarction. Myocardial infarction is also known as a heart attack. Myocardial infarction or heart attack is permanent damage to the heart muscle. It is a life-threatening condition that occurs when blood flow to the heart muscle is cut off, causing tissue damage. This is usually the result of a blockage in one or more of the coronary arteries. As you can see in this picture, there is a healthy heart and a heart with a myocardial infarction. On the other side, the heart with the myocardial infarction is having a cardiac ischemia, that is the blockage in the coronary artery. The definition of myocardial infarction is the necrosis of heart muscle secondary to prolonged ischemia. Myocardial infarction terms myo means muscle, cardial refers to the heart, and infarction means death of tissue. Risk factors of myocardial infarction include family history, obesity, hypertension, age, and sex. The male are having a more risk than female, and the age above 55 years having a more risk of myocardial infarction. Moreover, the diabetes, smoking, and preeclampsia. All these are the risk factor of myocardial infarction. The symptoms of myocardial infarction include angina, that is chest pain, a pain or discomfort in areas of the upper body, including arms, left shoulder, back, neck, or stomach, dyspnea, also known as shortness of breath, cold sweat, nausea, and vomiting. The diagnostic evaluation of myocardial infarction include physical examination. Physical examination include the vital sign, that is temperature and blood pressure, medical history, electrocardiogram, ECG, chest X-ray, and blood test. Blood tests include the full blood examination, that is known as CBC, the complete blood count, that will check the number of red blood cell and white blood cell and platelets. Another test is the cardiac enzyme test, that is CKMB, creatinine kinase enzyme, which is mostly found in heart muscle. It rises when there is a damage to heart muscle. Another test is troponin level, which is used to test a specific protein in the heart muscle, which is used to diagnosing myocardial infarction. There is another one which is lipid profile, which include HDL, LDL, triglyceride, and cholesterol test. And another one is a C-reactive protein, a B globulin found in the blood test that respond in inflammation. And the last one is ESR, erythrocyte sedimentation rate test. These blood tests goes into the various tubes. The cardiac enzyme CKMB test goes into the serum separation tube in chemistry lab. The troponin test also goes in SST, and the lipid profile also goes in serum separation tube. The full blood examination test goes into the EDTA, and ESR test goes into ESR sodium citrate tube, that is black color. There are various medical terms that are related to this disease condition. The first of all is myocardial infarction. Myocardial is divided into three terms, that is prefix myo means muscles, root cardial means heart, suffix infarction means death. Second one is necrosis. Necrosis means the death of tissue or cell. Prefix necro means tissue death, and suffix osis means condition. Another term is cardiologist. Cardiologist is a physician specialized in heart muscle. Prefix cardio means heart, suffix ologist, an expert in particular area. Another term is angina, which means chest pain. Another one is dyspnea. Dyspnea is a difficulty in breathing, that is also called shortness of breath. Prefix dys means difficult, suffix pnea means breathing. Ischemia. Ischemia is the lack of blood supply. Prefix isch means to stop, and suffix emia means blood. There is another term which is hypertension, means high blood pressure. Prefix hyper means high, root tension means pressure, hypertension. Preeclampsia. Preeclampsia terms mean high blood pressure in late pregnancy. These all are terms that are related to the myocardial infarction disease. Thanks for watching.